Today we're going to discuss a question that I get all the time. It's, should I buy an inversion table for my low back pain? And I think there's a lot of things that we need to discuss to answer that question. You know, some things that you should never do, maybe some contraindications, and I think we'll even probably touch on some injuries that occur when you use these types of devices. Hi, I'm Dr. Crockett. This is Dr. Sanders with Zeal Integrated Health, and let's talk about some things you should never do, because I hear these things and it just makes me cringe because I've seen all the accidents that happen from this kind of stuff.
In fact, these things are things we've heard recently. One of the first. Well, when I take the kids to the park, I'll hang upside down from the monkey bars. That usually feels pretty good on my low back.
Or they get on the stairs and they have people hang onto their feet on the stairs to like hang upside down on the stairs, right?
Absolutely. Sometimes having their smallest kid walk on their back, and if that doesn't work, they'll start having their teenagers walk on their back and eventually their wife.
Yes, yeah, it just increasing the weight, right? Yep. I think you heard one about a tractor the other day.
The tractor one is the best but the worst. He has a farmer friend, so the farmer friend wraps his legs up, hooks it to the tractor bucket, and lifts him up so he can hang there for a while and stretch out his lower back.
That's some Southwest Missouri innovation right there, right?
Absolutely Ozark intervention right there.
So obviously there are some contraindications when we start, putting somebody into an upside down position.
Absolutely.
And it's going to create, some health concerns when somebody's doing this type of stuff, even in an inversion table.
Even in an inversion table.
These things, when you start flipping that body upside down, there's just factors that we want to talk about. So
high blood pressure.
When pressure goes up and you turn it upside down, you're going to increase pressure in the head. And so you're increasing risk of stroke with that type of thing.
Speaking of strokes, if you had a recent stroke or any problems with strokes, no inversion tables.
You bet.
And with the pressure, glaucoma. If you want to increase the pressure in those eyeballs even more, hang upside down. That's really going to hurt.
Idea.
Horrible idea. With the eyes, also retinal detachment or any problems with the eyes, you don't want to be hanging upside down and increasing pressure.
With the ears, you start seeing things like vertigo, issues with dizziness. You definitely don't want to be putting yourself into this type of position. You can stimulate those things. Sinus infections can even have that increase in fluid there, and you flip upside down, you're going to increase that pressure there.
Osteoporosis and hip replacements or other artificial joints, it's not good to put those unrelated stresses or those stresses our bodies aren't used to having on those
joints aren't designed to hold stress that way, right?
Exactly.
So when we see people come into the clinic from using inversion tables, the stories we typically get are the injuries that have occurred from these. And I know for myself, one of the patients I treated early in practice, they were doing an inversion table and their feet came out of the boots, and next thing you know, they're dealing with a neck injury and facial,
broken nose, broken teeth. People have these things in their basement, in the garage, on concrete, around stuff. When they slip out of these things, sometimes it's 1 foot, sometimes it's both. They can't catch themselves. They're trying to catch themselves with injured shoulders.
And then, of course, you start seeing also damage to the spine itself. So we see spinal cord injuries, further disc damages that are occurring because they're not set up properly, or they're putting too much weight on a disc that's already compromised and creating a further issue. And then obviously they're coming in to see if we can help at that point. So obviously there's safer, more effective ways to treat disc injuries, back injuries. And if you'd like to hear more information on it, check out our decompression video. And just remember to subscribe and like and follow below.